Hi, I'm Laura, and I suffered with back pain for 19 years before I was able to get any major relief. Basically, what I was told when I first got injured on the job was that as long as I could deal with the pain, the better off I'd be. So everywhere I went, that was basically the same results I was getting, was as long as I could deal with the pain, the better off I'd be, because I stood a chance in being in worse shape after the surgery than before. So, there's nothing you want to hear. And I dealt with the pain as long as I could deal with the pain. It got to the point where I got some relief, and I guess in the first few years I got some relief for a while. I took injections in my back and stuff, and I'd get a little relief from that for a while, and you could go for a little while and cope for a while. So I did that, and it just got to the point where that wouldn't happen. I was on pain medication, so they was upping the dosage of pain medication to stronger narcotics, and I was scared of getting addicted to that. I'm taking like Oxycontin plus, Larset plus, and those are both addictive drugs, and I didn't want to be addicted. I didn't want to be on the street corner begging for money to get my pain medication, and be hurting and all that. So it got to the point where I couldn't hardly get out of bed. My bathroom is my commode, and my bedside is like about 3-4 steps for somebody that's not having a problem. And when I got to those 3 or 4 steps, it was like, 3 or 4 miles. That's what I felt like from doing the struggle getting there. Sometimes I'd have to have assistance getting up. Sometimes I'd have to have assistance getting dressed, out of the shower, get in the shower, and basically what you could do in the shower was just soap your upper body and just let the soap run off because you couldn't bend down. And so it was straining mentally and physically. There were days when I'm thinking, okay, I'm at the end of my rope, I can't go no farther. And with regular everyday life problems in there too, there's a lot to deal with. So some friends of mine recommended Dr. McCord. And I talked to him, I said, well, everybody's told me the same thing. I've gone to doctor, and they said the same thing. As long as you can deal with the pain, the better off you are. So they kept talking, well, I believe it's worth a try though, just try it. So I decided to try it. My youngest daughter was getting married, and the girl that was recommending Dr. McCord was somebody was helping me with the wedding. So I'm working from the bed with the wedding, and she was trying to help me out. So she says, you need to go on and do it before this. I said, no, I'm scared I'll be in worse shape. So just let me go on and get through this, and then I'll try. So we did, and after I got through the wedding, then that she got married in July, in April, I had my surgery. So the first 3 weeks, he said, would be the worst 3 weeks. And it was, but when I first came to Dr. McCord, the thing that I had made up in my mind would be my changing point would be whether or not he would be positive about the surgery. If he gave me a positive outcome, that would be what would I'd make my mind up on. So when he came in, he spoke and introduced himself. He says, why have you been hurting so long? Did somebody tell you it was no help for you? And I said, basically, yeah. And that had been what I'd been told. So he said, well, I can help you. And and that changed everything inside me. He just out and told me he could help me with no reservations, And this is something that I hadn't heard in the whole 19 years that I've been suffering. And so he went ahead and talked to me about the surgery, and then his assistant talked to me. And so I went ahead that day and started setting up for my testing to be done. I got a 3-hour commute between where I live and here, which was kind of uncomfortable and a little bit, out of the way for us to do. But my daughters brought me back and forth, and we went ahead and scheduled. I had mine done on Easter weekend, and the first 3 weeks, like he said, was my worst 3 weeks. I had problems getting comfortable was my main thing. I just couldn't get comfortable at night. I could do good in the daytime, but at night, it was like I just couldn't get in a good position to rest. And after that, basically, it's been good for me. I hadn't had any pain in the area that he worked on. Now, I have other problems that I have pains from, but not the back where he worked. I wished I had have known 19 years ago about it. So everybody that I see and everybody that I know that's having problems, I'm telling them about him. And he's done my daughter's back. He's done 2 surgeries on hers since he did mine. And I'm pleased with the results. I had the wedding. I went ahead and did the wedding first. I did the wedding in July, and then following April, I went ahead, and because it was downhill after. Well, the wedding time, I was sick during that time. I had been sick before that, and basically then I was in bed more than I was out. You know, at first it was like I'd be down a few days, and then I could get up and move around some, but I had got to the point then that I was in the bed most of the time. If I got out of bed, it would just like be for a day or two that I'd move around there in the house a little bit, and then it was just back to the bed. So, I mean, it just wore on my body and on my mind so bad then until I would have done anything at that point for the relief. So I went ahead in April and came on down and talked to him when I got to the point that, you know, I could get out of bed long enough to come. I went ahead and made the appointment, came on. Matter of fact, I went to one doctor and talked to him, and he told me, I think it was like a couple of years before I came down here, that he could do the surgery and everything, but the area that it was going to be working on, it was such a tiny area, and it was the central nervous system. And if any little thing at all went wrong, then I could be paralyzed for the rest of my life. And I was going to him to try to get more use of my body, more mobility, and then he's telling me the probability was going to be maybe more than not that I would be paralyzed, you know. So that put a damper on that right off. So I was back to square one, disappointed again and let down and depressed over. So it was a roller coaster ride. If you can, come and talk to him. Just come and talk to him. Don't expect nothing. Just come with an open mind that, well, I'm gonna give him a chance to come down and talk to him and explain to me what he think, if he think he can do anything, and just go from there. I think it'll be worth the trouble. I do believe he'll be honest with you. If he couldn't help you, I think he'd tell you right off, you know, because he's just that kind. Don't expect him to buttercoat for you, because he's not like that. He might not laugh and talk and joke with you, but he will listen to you, and he's very serious. He takes his job very seriously. I've recommended, I think, about 4 people to come since I've been. So I'm convicted.